Good afternoon, everyone. Happy Nurses Week 2022. It is my distinguished honor to welcome you to our Downstate Health Services University Nurses Week recognition ceremony. It is with thankfulness and gratitude that we salute our nurses here at Downstate Health Sciences University. You have made a difference, and you will continue to make a difference here at Downstate. We will begin our reception this afternoon, starting with remarks from Ms. Ruth O'Donnell, our Director of Nurses. Oh, I see Reverend Walker is coming, and we will ask her to do the invocation. Thank you.
That's okay. I totally understand. Good afternoon, everyone. I do want to greet you again from the Department of Spiritual Care, to share with you that it is an honor to be with you again, to celebrate, to honor, and to rub shoulders, to absolutely rub shoulders with the finest nursing professionals in our great community, in our city, I would dare say in society, certainly those of you who are right here at SUNY Health Science, Downstate Health Science University. I want to share with you that it is my hope today that each of you will, to a greater degree, on a larger scale, embrace what it really means that you make a difference. It is more than words. I pray that you can embrace that. Know beyond any looming doubts today, know beyond any struggles, know beyond any disappointments or setbacks, that your impact on healthcare is indeed exceptional and unprecedented as it affects the health and well-being of community, society, and I dare to say around the world, as many of you have done missions. I honor you today. We honor you. Thank you for your continuous and selfless and steadfast ability to press on even in the midst of trouble. Thank you for your tireless efforts. Thank you for your sacrificial care. Thank you for the advocacy for patients and families who receive the kind of quality care that you give to them. My brothers and my sisters, you make a difference, an absolute difference. Stand with me if you can for the invocation. All minds quieted. God of many names, weaver of the universe, divine presence, almighty God, we thank you for this day. We thank you for this right now moment when these, your nurses, can look back, can stand in their right now, oh God, can be present with you, and can look to the future knowing that you have kept your promises to each of them when you declared in your word, I know the plans I have towards you. The plans are to prosper you, not to harm you, to give you a hope and a bright future. You have delivered for us. We still have more delivering to do through you. And with God by your side, you will be delivered. Oh God, I ask that you would bless the speaker, Dr. Yvonne Nathan. Fill her with the message that takes your sons and daughters to a deeper place. Oh God, allow them to hear her from a deeper place regarding the professional calls, the quality and the innovative practices that they're called to. Bless their call. Bless their walk. Confirm in each of them that they're more than conquerors. Confirm that they must lead, that they must excel, that they must transform. Oh God, remind them that they must encourage and contribute and maintain compassion and be welcoming and serve with equity, and they must collaborate, oh God, and that they must be accountable and respectful so that the excellence will always be their banner and they would hear you say, "Well done, thy good and faithful servant." Spirit of the living God, fall fresh right now. Amen.
Amen. Thank
you. Good afternoon, everyone. Hello, beautiful people of University Hospital of Downstate. Happy Nurses Month to all our wonderful nurses. For the third year in a row, the American Nurses Association has replaced Nurses Week with Nurses Month and has extended the theme, Nurses Make a Difference, to honor the varying roles of nurses and their positive impact on our lives. The month-long celebration makes room for more gestures of appreciation and more opportunities to show the value nurses bring to our communities. We have to remember that we nurses are making difference every single day in someone's life, no matter how big or small. Each week of Nurses Month has a theme. First is self-care. Let us remember to invest in our well-being and address our own self-care. We have to take care of ourselves so we can take care of each other, we can take care of our family, and we can take care of our patients. Secondly is recognition. Let us recognize each other for the work we are doing every day. Appreciate each other and offer gratitude to those efforts. 3 is professional development. We need to continue investing in professional development so we are ready to lead the future of healthcare. Learn new skills, new knowledge, and education. And lastly is community engagement. Our impact goes far beyond an individual person. It extends to our communities. We need to be advocates for those in need care, equity, diversity, and inclusivity for those we serve. Our profession continues doing what it does best, making a difference, and that's what we celebrate this Nurses Month. Today is a very exciting day because we will be honoring our nurses who displayed exemplary performance, and they will be recognized for their dedication and commitment to the nursing profession. And I'm very, very, very excited. So let me introduce to you our wonderful Chief Nursing Officer, Ms. Cheryl Ralston, who will be introducing our speaker.
Thank you, Ruth. Well, our speaker today is Dr. Yvonne Nathan. She's from our College of Nursing, our own School of Nursing, and she is going to bring us greetings on the theme of Nurses Make a Difference.
Good afternoon, Dr. Riley, Dr. Escalia, Ms. Ralston, the Nurses Week Committee, Brenda Ellis, Carol Moreira, Shay Walter, all categories of nurses, RNs, advanced practice nurses, nurse educators, colleagues, students, and the University Hospital at Downstate. This week, we celebrate all nurses at University Hospital at Downstate, both at the bedside and those working to support us. Each of you is raising the bar in new ways, creating strong teams, and working in service to others. It is your passion and hard work that will help us shape the future of healthcare. This year's theme for Nurses Week is You Make a Difference. This year, more than ever, we are looking to your voices and ideas for innovation and improvements to elevate nursing practice and define what it means to promote compassionate, connected care. Welcome to Nurses Week 2022. You make a difference. You certainly make a difference. Acknowledging the hard work, long hours, and emotional duress that are part of the life of every nurse, even on Nurses Day, you still make a difference. This theme was designed to focus and reflect on real values that nurses bring to people all over the globe. Nurses have an enormous amount of knowledge and many diverse skills. They spend years perfecting and developing, all the time working in decidedly tough environments where extreme stress is just a part of the job. Nurses help bring new life into the world, care tirelessly for the sick and injured, and sometimes watch the patients they did everything to save pass away despite their best efforts. On many occasions, it was a vigilant nurse who noticed a mistake in a doctor's prescription in time to save someone's life. I cannot emphasize enough the importance of such an event as this that recognizes the additional efforts and personal sacrifices all nurses in all professional settings make daily without the expectation of acknowledgement or an award. Nurses have a long history of promoting social change from our place at the patient bedside. Our professional history is rich with social activists such as Florence Nightingale, Margaret Sanger, Dorothea Dix, Lillian Wall, and Mary Breckinridge. These are individual leaders who sought to transform the social determinants of health while providing care to the most vulnerable and marginalized population. This is history as we know it, but it is his story. What happened to all the inclusive contributions of nurses who have shaped our history to be what it is today? Well, to start with, yes, we have Florence Nightingale. Everyone knows she served as a nurse in the Crimea War and is universally lauded as the founder of modern nursing. History or his story forgot to include the nurse who was at her bedside, Mary Seacole, a Black Jamaican woman. Namhioki Slocum Curtis. She also served as a contract nurse in the Spanish-American War and was given a government pension for her services. She is buried in Arlington Cemetery. Isabella Bounfrey. Most people do not know the name Isabella Bounfrey because they know this particular person as Sojourner Truth. You all know she was born a slave in New York State and was freed by the New York State Emancipation Act of 1827. She changed her name to Sojourner Truth to reveal the nature of her mission. Sojourner, because she would travel, and Truth, because she would tell the truth about slavery wherever she went. Because of the newly freed slaves, many sick, decrepit, mentally ravaged, and destitute poured into Washington, D.C. from the South as slavery that had been abolished in D.C. earlier, with the hope that their needs would be provided for. The War Department of the U.S. established the Freedmen's Bureau as an emergency facility. Sojourner Truth worked as a nurse counselor for the Freedmen's Relief Association during Reconstruction period in the Washington, D.C. area. Many of her actions were sanctioned by President Lincoln. Today, the Freedmen's Hospital and its School of Nursing became part of Howard University. Harriet Tubman, an American abolitionist and political activist. She was also born into slavery and escaped, and subsequently made more than 13 missions to rescue enslaved people, family, and friends during the network of anti-slavery activists in safe houses known as the Underground Railroad. She worked as a nurse for the Union Army and then as an armed scout and spy. She was the first person to lead an armed expedition in the war, which liberated more than 700 enslaved people. She is an icon of courage and freedom. Mary Mahoney, first Black licensed nurse to graduate from a school of nursing in the United States. She co-founded the National Association of Colored Graduate Nurses. We have other Black contributors to the nursing profession who made a difference, but the list is too long, and I do not have the time. If these facts are unfamiliar, it's because the contributions of Black men and women to nursing have largely been invisible. Take, for instance, Mary Elizabeth Carnegie was an educator and an author in the field of nursing. She was known for breaking down racial barriers. She was the first Black nurse to serve as a voting member on the board of a state nursing association. She later became the president of American Academy of Nursing and edited the journal called Nursing Research. Mary Elizabeth Carnegie researched the lives of elderly Black nurses. She graduated from Lincoln Hospital School of Nursing in 1934. At that time, is one of the few schools in New York City that accepted Black students. It was difficult for Black nurses to find employment after graduation because only 4 of the 200 hospitals at the time would hire them. She eventually found a job at Lincoln Hospital in the Bronx. She immediately addressed the practice of the doctors and nurses for calling Black nurses by their first name and referring to white nurses as Miss. She was always outspoken on these issues. Dr. Carnegie wanted to serve her country during World War II, so she applied to the Navy Nurse Corps. However, her application was rejected, with the explanation that Black nurses were not assigned to the Navy and that the letter that she received indicated that if they did accept her, she could not be housed with the whites. It was not until 1945 that Black nurses were accepted into the U.S. Navy. Dr. Carnegie contributed to this knowledge by writing a book entitled The Path We Tread. It was her desire to bring this significant past out of the shadows to receive the recognition it deserves. Growing up around some of the influential American nurses who made a difference, not only was Dr. Carnegie was in my presence, she was in my presence as it related to my aunt Ivy and Tinkler. She was the first. She was the first Black director of nurses at Lincoln Hospital. I did not really have an appreciation of Black nurse leaders while growing up. The only thing I knew was that I wanted to be a nurse and a teacher. That's all. I didn't realize I was being mentored into the role of the next generation of nurses who would make a difference. My aunt, Ivy Ann Tinkler, would invite her dear friends to some family functions. When my aunt and her closest friends would meet, invariably the discussion centered on what's going on in the world of nurses for our people. My aunt was very close to Dr. Mary Elizabeth Carnegie. She would attend family dinners several times a year. There would be great discussions about writing memoirs about the path the Black nurses had to take in order to be accepted in this country. Not realizing that those great discussions and debates would help formulate my role as a professional nurse and educator. These early leaders were devoted to a discussion of the involvement of Black nurses in those national organizations that have been significant in the history of nursing. Another Black leader that's not very well known is Mabel Keaton Storpers. She was a Caribbean American registered nurse who immigrated to the United States with her parents at the age of 13. She is most revered for her instrumental role that she undertook in eliminating racial barriers in the Army and Navy Nurse Corps and civilian nursing institutions during a time in which the use of segregation methodologies prevailed in the U.S. Ms. Storpers graduated from the Freedmen's Hospital of Nursing, which is currently Howard University School of Nursing. Early in her nursing career, she was faced with the harsh realities of racial discrimination, which made her to realize how important multidisciplinary collaboration would be when attempting to address the dynamic environment and social issues that plague African Americans during World War II. She was appointed Secretary of the National Association of Colored Graduate Nurses. Mrs. Storpers effectively used this venue to organize local and state nursing organizations. In 1945, all of her perseverance and hard work paid off, as evidenced by the full integration of Black nurses into the armed forces. For 20 years between 1951 and 1971, Mrs. Storpers was instrumental in getting the NACGN, the National Association of Colored Graduate Nurses, into the dominant organization, the American Nurses Association, which was segregated at that particular time. Once she was able to get the NACGN integrated into the American Nurses Association, Mrs. Storpers felt that there was no further need to have the NACGN, and they disbanded the organization. She felt that as nurses, we are always caring for our vulnerable populations. Why do we want to make a difference? Vulnerable populations are defined as those at greater risk of poor health and health risk status. The number of medical problems and the rising cost of health care leave certain vulnerable Americans struggling to find timely access to affordable health care. As nurses, we know that vulnerable populations are at greater risk for developing health problems that contribute to declining health, low understanding of their diagnosis or treatment, and contract communicable diseases. You're probably also asking yourself, then why do we care? Why should we make a difference? Because as nurses, we understand that conditions in which people live, learn, work, lay, and worship can impact health and produce health disparities. Social determinants that negatively impact health and well-being include poverty, lack of access to quality education or employment, unhealthy housing, unfavorable work and neighborhood conditions, exposure to neighborhood violence, and the clustering of disadvantaged and particular groups of people and particular places. As nurses, we understand that health disparities have an incredible economic impact on the country. If the nation was able to decrease disparities, it would be a significant financial advantage to the United States. By eliminating racial and ethnic disparities, would reduce medical care costs dramatically and indirect costs of excess morbidity and mortality. Nurses, we are advocates for the vulnerable populations. We are the voice of the nurse, which is the most reliable tool for advocacy. Silence is never the answer. Nurses should advocate to promote equality and adequately address the social determinants of health. This includes finding the patient resources and collaborating with the team. As nurses, we make a difference with the vulnerable populations by advocating for the right social policies to promote justice, fairness, and health equity and adequately address the social determinants of health. Some nurses volunteer by using their medical knowledge to promote health in their communities. We also know that people's zip code is very much a greater indicator of healthcare outcomes than their genetics. NPs have proven to be a vital resource in addressing social determinants of health, which is key to mitigating health disparities for specific targeted groups. In addition, the RNs, NPs are known for building strong patient relationships, putting them in a position to uncover certain social determinants of health. Thank you all nurse practitioners for the fabulous job you are doing to keep all well within our limitations. Because we make a difference, there has been a demand for a broader scope of practice for nurses in certain roles. The demand for nurses will only grow post-pandemic, as well as the rigors of the job. The COVID pandemic caused massive disruptions to our economy and labor market that have yet to abate. It has also particularly underscored the plight of workers in one of the widest health occupations in this country, the nurse. Over the past year, those on the front line have reported increased rates of burnout, declining mental health and distrust, and disengagement from the organizations employing them. Some are considering leaving their roles for jobs not involved in direct patient care or retiring. We are faced with a population that's both aging and seeing behavioral and mental health conditions, and in the workplace will likely help tackle healthcare policy and equity issues. For the profession to meet the needs of our communities over the next decade, a substantial increase in the amount, type, and distribution of nurses across geographic areas, specialties, and care settings is needed. To ensure an adequate nursing workforce, I believe there are 3 key initiatives recommended that nursing schools, employers, and policymakers should adopt. 1, permanently broaden scope of practice. The pandemic resulted in a few states to temporarily roll back restrictions for nurse practitioners who typically worked in primary care settings, thus allowing them to prescribe medication, diagnose patients, and provide treatments without the presence of a physician. Of course, they stepped in and stepped up and did a fabulous and amazing job in keeping our communities and populations healthy during this dark time. Of course, permanently granting full practice authority to nurse practitioners across the U.S. would eliminate a key barrier affecting workforce capacity. Just recently, New York State Governor Kathy Hochul signed a state legislation that granted nurse practitioners full practice authority, making it so that NPs do not need signed off from an authorizing physician to provide certain services and care to patients. With full practice authority, NPs in New York will continue to evaluate, test, diagnose, manage treatments, and prescribe medications for patients without having to sign a contract agreement with a supervising physician, eliminating previous barriers that would have limited patient access to care. Such scope of practice expansion will continue to improve patient access to high-quality health care, especially as the healthcare industry is facing major staffing shortages post-pandemic. With the NPs having full practice authority, will make a difference by reducing the primary care provider shortage. Going forward, hopefully these changes will help New York attract and retain nurse practitioners and provide New Yorkers better access to quality care. Until all nurses are permitted to practice to the full extent of their education and training, we will continue to see significant and preventable gaps in access to care. Since removing those restrictions for NPs was beneficial in expanding the public's access to care during the pandemic, it seems counterproductive to reimpose those barriers as we make a difference. 2, strengthen education and equity is the second initiative. Nurses with a bachelor's and doctoral degree are needed, along with those in certain specialties with existing shortages such as primary care, long-term care, behavioral health, and public and community health. That's in part because nursing education programs have traditionally emphasized training for care in hospitals rather than other settings. Those programs should increase their coursework and hands-on experience for students in community settings, primary care facilities, rural health clinics, and other similar, smaller points of care. Nursing programs should also familiarize themselves with the technology that will likely be embedded in their practice in the coming decade through training on new tools, including telehealth and artificial intelligence. Effectively preparing students for the challenges they face regarding health equity, racial disparities, and social determinants of health is also crucial, as is building a diverse nursing workforce. Nursing roles are overwhelmingly held by women, and faculty and nursing programs are overwhelmingly white and female. The workforce must better reflect the population it serves and has a long way to go. Leadership can play an important role in acknowledging the history of discrimination and implicit bias in healthcare. And it's crucial those high-up roles are increasingly held by nurses of diverse backgrounds. Lives I have touched throughout all these years of nursing working occurred with September the 11th, 2001, commonly known as 9/11. I will never forget what I was doing and where I was on September the 11th, 2001. In the morning, just before 9 a.m., I was in Lecture Hall 1A conducting a professional nursing development class. When around 8:50 a.m., I started hearing cell phones and beepers going off by the students being polite and did not want to create fuss or confusion. A couple of them left the classroom to answer those calls. When I saw their faces, I knew something terrible had just happened. The beepers and cells continued to alert the nurses of this disaster. These circumstances of events changed lives on September the 11th. Our lives in the social order of America changed. September the 11th, known as 9/11, brought to most Americans an understanding of what it is like to feel the threat of terrorism. For many of us, it was the first time we bore witness to the effects of terrorism as the images of New York World Trade Center towers and the Pentagon played over and over on our television screens. The events of September the 11th may have also heightened our sense of patriotism, family and community solidarity, and resiliency as the students were advised to check on their family members first and then call their workplace to determine if they needed to return to work to help. Now, cellular service was completely gone. In the first minutes after the plane hit the towers, New York City's 911 call center became flooded with calls throughout that day. I don't think we ever thought that our vital communications would ever cease to work, as this link was based in the North Tower of the World Trade Center, but it did. The lesson for me for making a difference is that in addition to the psychiatric and societal misery, terrorism places an exceptional burden on all of us while delivering healthcare services. Going forward, we need a responsive and well-prepared healthcare system that ensures effective management of terrorism-related events. Since the 9/11 attack on the World Trade buildings, the College of Nursing focused greater attention on the importance of nurses' disaster preparedness and response towards terrorism-related events by incorporating disaster preparedness throughout the curriculum as one of its primary and essential threads. The third initiative, promote, track, and manage mental health and well-being. Numerous reports have shown an uptick in burnout and mental health issues among nurses throughout the pandemic. In the future, they're expected to face more health and social justice issues in the workplace that will make their jobs even more emotionally taxing. Nurses from underrepresented groups also face a diversity tax, which is characterized as being asked to serve on diversity committees and other activities that are often uncompensated and unrewarded. Those demands can worsen burnout, and equity initiatives shouldn't be treated as separate from everyday activities and responsibilities. In order to support our current and future workforce, employers have to provide adequate space and support, something they haven't excelled at. Data is coming out about approximate that some of the frontline healthcare workers felt the pandemic had negatively impacted their mental health. I believe some of them needed mental health services or medication but didn't get any of them. I am sure many were too busy or unable to get time off from work, feeling afraid or embarrassed or just being unable to afford the medications. Their primary focus was patient care during this disaster. Policymakers, employers of nurses, nursing schools, nursing leaders, and nursing associations all have a role to play to this end. Using the metaphor, the king is dead, long live the king. Despite all of it, we are here and we thank God, although the challenges are still looming. We survived the crisis slowly, yet strongly rising up. Our strong faith in ourselves and others gave us the wisdom and strength to combat this plight. Nurses were overworked and exhausted, but beneath the protected mask, they were smiling with their eyes, knowing they tried their best to cheer up patients, get through this unprecedented crisis. It is important to remember why each of us chose nursing as a career in the first place. Knowing it was not easy. Retrospectively, we realized that the future waves of COVID were chances and opportunities to learn, to grow, and to live. One appreciates the vital work nurses are doing to care for people, to keep the communities and the world in general safe in these very difficult times. This year, we celebrate the nurses. This year, we celebrate the work of all nurses and NPs by highlighting the challenging conditions they often face, and advocate for advancement in nursing and all the advanced practice roles workforce. Nurses have already installed 2022 year of making a difference with their courage, compassion, and dedication to patients around the world. The theme is inspired by my personal and professional journey and my vision for the future of nursing. Early in my career, I walked away from nursing after failing my first nursing class with an 85% overall average. I needed to step back to move forward. Today, nurses are at a threshold, the cusp of a new and different world, one we can't yet completely imagine. It is the future of nursing as a profession, not its past, that makes me confident about the men and women undertaking their nursing education today. Nursing will play an even greater role in delivering a better, sooner, more convenient healthcare service for all. In primary healthcare alone, due to the pressures of our GP workforce and the drive to meet patient demand for more convenient healthcare, you as nurses are already making a greater contribution as part of the family health team, and that will increase. Nurses are also reaching new levels of competency as the demand for more complex nursing care increases. I wish many congratulations to all the nurses on this important day. You deserve our admiration and respect for the dedicated work that you all perform within your workplace. Many congratulations on this Nurses' Day. To all the registered nurses and healthcare providers, I want to say again and again, thank you. You make a difference.
Thank you, Dr. Nathan, for such an engaging presentation. Our program continues with the Awards of Nursing Excellence. Our Director of Nursing Education, Dr. Karen Brooms-James, would be conducting this segment of our program. Thank you.
Good afternoon, everyone. Thank you for coming to our program this afternoon. I would like to acknowledge the presence of our senior leadership members, Dr. Berger, Ms. Ralston, Dr. Winston. I see Primrose in the back. And everyone else. Thank you guys so much for being here today. I want to thank those who contributed to bringing this award function to fruition. It was definitely Ms. Ralston, who is our executive sponsor for the event. We thank you for your support. Our Nurses Week committee members. Can I ask the committee members to stand, please? Thank you guys so much for your hard work, dedication, for helping us with reviewing, and for voting for our nominees and awardees. To our Downstate staff, you guys have been phenomenal. We received over 200 nominations. We recognize you for your willingness to point out excellence in your peers. We would also like to ask at this time, if you were nominated for an award, we want all nominees to stand so that you'll be recognized. If you were nominated, please stand. Congratulations. And we would like to welcome Dr. Lazar, our physician colleague. Thank you for coming, Dr. Lazar. And thank you for your nomination. We would like to thank the members of the ICL team who worked tirelessly. Thank you. We want to just make a small note that unfortunately a few nominations were disqualified because of missing information. So if you don't see the name of the person you nominated, that may be the reason. If you have any questions, please see us in the ICL office at 1J 440 Lenox. Thank you very much. All right, so we're gonna move ahead now to begin our presentations of awards. The first category would be our Clinical Practice Awards, and the criteria for this, as stated on the application form, the recipient of this award will be a registered nurse who consistently embodies excellence and utilizes exemplary skills and knowledge in caring for patients in the hospital and in the community. This nurse regularly promotes the use of evidence to improve his or her own practice, as well as overall nursing practice here at University Hospital at Downstate. This nurse demonstrates professionalism in every aspect of care. At this time, I'll ask Ms. Ralston to come forward to assist us in presenting our Clinical Practice Awards. Thank you. When we announce the names of the winner, if the ADN or Director of Nursing for that area is here, you can feel free to come forward to also take a photo and support your staff member. For Advanced Practice Nursing, we have Jotha Richards Williams. We would like to ask Susan Fraser McClary to come forward. She's the AVP for the area. Thank you. picture. All right, so this person, this was said, goes above and beyond to ensure that her patients and colleagues are supported. She's an excellent worker and colleague, and she's an asset to the organization. They also said she will stop at nothing to ensure that our patient safety comes first. Thank you. Okay, so our next award is for clinical practice in ambulatory or clinic nursing. And this nominee, based on the nomination, this is what was said. For the last 20 years, this person has been an invaluable and exemplary member of our medical center. Her warmth, smile, energy, and commitment in the midst of crisis are nothing short of remarkable. Her organization skills and attention to detail are exemplary. The nominee assures that her patients get what they need and avoid what they do not. So we would like to thank Leslie Woods from Suite N. I would like to invite Reditha Abrahams-Nichols to come up and take a photo with them. Oh, is Judy Asher here? Yeah. Miss Asher? Oh, okay. Thank you, Dr. Winston. Congratulations, Leslie. Our next award is for critical care nursing, clinical practice, critical care. And this is what was said about the nominee. The nominee demonstrates clinical skills with ease, comfort, and confidence. Her wealth of knowledge serves as a resource for her colleagues. She has an immense capability of dealing with emergencies with a calming nature. Deals with emergency, oh, sorry, I repeated that, just for emphasis. All right, and the winner of that award is Lillian Prophet from the MICU. Congratulations. All right. Okay, our next award, the recipient from the Emergency Department for Clinical Practice. And this nominee goes above and beyond to assure the unit is running like a fine-tuned clock. The nominee is always first to an emergency. The nominee will go to a code and not leave until the patient is stable. We would like to congratulate Yonette Parks. Congratulations, Yonette. and Mr. Edie will join us. Okay. All right. Our next award goes to our L&D postpartum. I don't think I have the right one. L&D OB postpartum, and this person consistently demonstrates the will and the ability to go above and beyond for her patients. Thinks proactively, anticipating possible issues and advocating for her patients. Routinely takes initiative to educate mothers and help teach them to breastfeed. Develops a rapport with her patients and is fully invested in their care. And the person receiving this award is Harriet Mbele Dulce. I'm not sure if she's here. Can anyone from her department? Okay. Okay, so we will move on. Okay, our recipient for medical nursing, and we had a tie, so we have 2 recipients in this category. The first one is a problem solver, team player with a sense of humor, commitment to patient care, and empathy. The nominee is willing to take charge in any difficult situation, exhibits strong communication skills with patients and staff. The nominee's integrity is outstanding. She is compassionate and kind to patients. And this person is Deborah Deschamps. Okay, that's another night shift nurse. So we'll get the, Ms. Bristol, please accept on behalf. Okay. The second recipient for clinical practice, medical nursing. The nominee is always eager to take on new and challenging assignments, is a great patient advocate with assertive leadership abilities. The nominee is the wound care associate on the unit and also assists colleagues on other units in assessing pressure injuries, demonstrates thoroughness and orderliness in delivering excellent patient care. And this person is none other than Marie Luke. Nursing station 7274, we'll get it on to her. Okay. All right. Our next category is for Pediatrics, PICU, Nicu nursing, and this nominee delivers an excellent standard of nursing care with compassion and a human touch. The nominee will sit and speak with patients and parents going through a difficult time, anticipates the needs of patients, and provides what is necessary to ensure her patients feel cared for. And this person, the recipient is Joan Gross, Nursing Station 42. Okay, I don't think she's here with us today, so we will get her award to her. Our next category is perioperative nursing, and this was extended also to our Bay Ridge facility. An all-around excellent nurse, has a high degree of competence and compassion, is quite knowledgeable in area of specialty, provides superior care under all circumstances. The nominee is the first person I call when I encounter an impasse during surgery related to equipment needed or device setup. And the person receiving this award is Marivic Padilla. Is she? we are inviting Amarita Santos, her ADON, to join. Congratulations. You're welcome. Okay, our next category is surgical nursing, and this awardee always takes the most difficult assignments, is very helpful to new nurses and nursing students, has great patient and bedside care, has great work ethic, shows compassion with her patients, and demonstrates professionalism and caring. And the winner is Kershel Albert, Nursing Station 82. Congratulations. Okay, and our final Clinical Practice Award for Progressive Care Nursing. The nominee has shown exemplary skill and care with exuberant compassion, is very thorough when providing care for patients, advocates for patients, and collaborates well with colleagues, treats patients as family members, teaches as they work, collaborates with colleagues and advocates for patients, uses knowledge and experience to envision the steps that will lead to effective care and patient comfort. And the person receiving this award is Mr. Selwyn Augustus from 7173. He also works the night shift. Ms. O'Donnell will collect on his behalf. Okay, we will now move on to our Nursing Distinction Awards, and the categories were attendance, dedicated service, education, research, evidence-based practice, mentorship, peer leadership, rising star, and team player. The first category would be for attendance, and this person is dedicated to timeliness and punctuality, never leaves work undone, and as such exemplifies commitment until the work is complete. The first to arrive at the suite even before her time, ensures that staff is cared for before leaving. And the person receiving this award is Ms. Kathleen Garraway Thomas from Suite G. Congratulations. Our next category is for dedicated service, and this is for someone who has worked at Downstate for greater than 10 years and who has demonstrated excellence in nursing. The nominee has been in the department since 2003, has served as a strong patient advocate, enhanced our quality improvement, and helped with staff training. The nominee's competence and overall excellence in patient care and documentation have kept our patients safe, and that is so important to us. The winner is Deborah Bradley Dean. Dr. Lazar, can you come up and take a picture? Thank you. And Gemma?
Congratulations. Our next category is Education, Research, and Evidence-Based Practice. The nominee has constantly demonstrated evidence-based practice skills and shares knowledge with nursing staff and patients, developed many tools and nursing policies for nursing staff, is the co-founder of multiple nursing councils and has membership in many others, has outstanding interpersonal skills, values and characteristic excellence needed to cultivate relationships. And the winner of this award is Ms. Linda Cohen. Oh, you're right. Congratulations. Our next category is mentorship. The nominee is an extraordinary mentor, stepped seamlessly into the role of mentor with her calm, caring demeanor, and is a natural mentor. Guides and advises new nurses in a judgment-free zone. Gladly shares knowledge and experience, assisting the new nurse to attain success. Models professionalism, teamwork, collaboration, and is an asset to the unit. And the person receiving this award is Vanessa Bristol Lewis, Nursing Station 42. Okay, so the award is being collected on her behalf. Thank you. The next category is peer leader. This person should be able to influence the team positively toward excellence in practice. And according to the nomination, this person is a great nurse, professional always, ready to help whatever the situation, assists others even when the patient is not assigned to her, very organized, respectful, hardworking, and compassionate. The research and evidence-based nurse of the unit contributes so much without the official title of leader. And the winner is Avalon Adams from Nursing Station 81. Congratulations. Our next category is Rising Star, and we have a tie in that category also. And this category recognizes someone with 12 to 18 months nursing experience who is already off orientation, but demonstrates a passion for nursing and delivers excellent patient care. And the first person, the nominee, is always dependable, efficient, and respectful, handles difficult situations with remarkable skill. Patients frequently share compliments about the nominee and the care they deliver. The nominee chooses to switch with his colleagues instead of calling out. And this person is none other than Mr. Kingsley Joseph. Congratulations. Our second rising star is a new registered nurse on the unit,
but is considered an excellent nurse. This person is compassionate, empathetic, a team player, and eager to learn, has great communication skills and pays attention to details, an exceptional professional. And this person is Gilisha Arjun from PIRR. Congratulations. Okay. All right, so our next category is team player, and this should be a nurse who is an all-around asset to the organization, a team player willing to lend assistance when and where needed. And our first nominee is a great team player during unit crisis and code activation, routinely offers help and assistance to other staff during busy shifts, and is very supportive. A wonderful colleague, competent and always attentive, ensures other team members get their breaks, and helps colleagues deliver safe patient care. And the winner of this award is Ekaterina Kashkin from Nursing Station 26. And Gemma will collect on her behalf. She emailed me that she couldn't make it. She had a family emergency.
Thank you.
Okay, and our second team player is an effective, competent nurse who is dedicated, committed, caring, well-organized, and focused, always willing to help and go where needed. Left her unit to assist in delivering care to a patient when there was a staffing issue on that other unit. And this person is Sandra Nestor from IR. Congratulations. Okay, we're almost at the end. We have one RN3 Leadership Award and our Nursing Leader Award. For our RN3 Leadership Award, this person is a dedicated leader and a patient advocate. Excellent RN3 is always in the unit working side by side with the staff, ensures the function of the unit, ensures the unit is run effectively, advocates for the staff, is an effective manager who strives to have the unit function smoothly. And this person is Tracy Ann Martin Miller from dialysis. Mr. Boucher will collect for her. Our Nursing Leadership Award goes to someone who demonstrates strong, transformational, and committed nursing leadership. And this is our Senior Leadership Award. Okay, the nominee exhibits an exceptional dedication and love for nursing care. The nominee is not just a nurse leader completing a 9 a.m. to 5 p.m. shift, but is on call and accessible 24 hours per day, any day of the week. The nominee's patience and willingness to assist nursing staff and even doctors on the unit is remarkable. A great mentor who motivates staff to do better and achieve more in terms of practice, education, and self-development, is authentic and committed to patient safety and satisfaction. The nominee is, in simple terms, the Nightingale of Downstate. And this person is none other than we are so sorry that Ms. Botang is out of the country, but she has sent us a video to express her thanks, and the members from her nursing unit will accept the award on her behalf. Let's cue the video, thanks.
Good afternoon, and happy Nurses Week to all the most wonderful nurses at Downstate. I am so honored and grateful to have been selected for this year's Nursing Leadership Award. I'm also honored to have my peers recognize me for what I'm so passionate about. All the nursing leaders deserve to share in this award. I would like to thank all my nursing staff for their love, support, and hard work to make this possible. It is always a pleasure to come to work because of you guys. I would also like to thank our nursing leadership, our CNO, and all who have mentored and continue to inspire me to make this possible. Thank you to the wonderful Downstate leadership for creating a wonderful WeCare environment to serve our community. Happy Nurses Week to all the amazing Downstate nurses. Thank you for always giving your best and for making sure that you gave extraordinary care to our patients daily. Thank you for making a difference every day and for being the heart of our community. Once again, thank you for the Leadership Award and happy Nurses Week to everybody.
No. Thank you and congratulations to all nominees and winners. You guys rock. Congrats. Dr. Berger will bring us a few remarks at this time.
Wow. That was just amazing and inspiring. So as a physician, I can say this. It's obviously why doctors only get a day and the nurses get a month. I just want to congratulate the whole nursing staff, and I really think we need to acknowledge our CNO, Cheryl Ralston. When I walk around the units and with Cheryl, I just see the love and the respect that all the nurses have for our CNO. And I think that really showed itself this afternoon. So thank you, Cheryl, for what you do every single day. Thank you for leading this amazing team. And thank all the nurses for joining the leadership on our WeCare journey as we seek to become the best place in Brooklyn to get care and the best place to give care. So thank you all.
Thank you, Dr. Berger. Okay, so our Nurses Week committee, we composed our theme song. We only had one opportunity to sing this song, which was yesterday. It's not on the program, but we would like to sing our theme song, and you can join in with us. Our lead singer would be Ms. Cheryl Vincent. All committee members, if you're here, could you join us, please? Mm-hmm. You get track? Are we singing a cappella?
No, I have it.
Okay, good.
Anybody else coming?
Would anyone else like to join us? It's
From the committee?
Or you can join us from the thing. Okay.
Okay.
I
I can see nurses make a difference now. We're saving lives each and every day. Now everyone has come to realize we shine so bright, we make a difference every day. We shine so bright, we make a difference every day. We can see clearly we are heroes now. So many challenges we've had to face. And even though it really has been tough, all over the world, we make a difference every day. Look all around, we're saving the nations. We forge ahead with the new dedication. Our HRO journey now is on the way, right? Our motto, we care, ushers a bright new day. We are heroes of Downstate and we lead the way. We save it right, we make a difference every day. Shining our light, we make a difference every day. We're saving lives, we make a difference every day. All over the world, we make a difference every day. We shine so bright, we make a difference every day. We shine so bright, we make a difference every day. Woo! We make a difference every day. Happy Nurses Week to all my beloved nurses.
Thank you. She's gonna come.
All right, we just have a few closing remarks. My name is Shay. I'm ADN for Nursing PI. Wow, that was amazing. Thank you for the song. Thank you for the ceremony. Thank you everybody for coming today. Maya Angelou has a quote, "I think a hero is any person really intent on making this world a better place for all people." And that's exactly what I saw today through your nominations, your stories, and just your love for one another. I wanted to thank and congratulate everybody who actually won an award, but more importantly, everybody who nominated somebody. I think today is a perfect example of how a kind word, a letter, or just a thank you can go a really long way. I've been at Downstate for about a year now, before coming back to the East Coast. I've worked at 2 or 3 other hospitals that claim to be the best, and I'm gonna have to break the news to them. After today, I firmly know that SUNY Downstate, our nurses and us, we are the best. So go Downstate. I just wanted to say that I think that makes each and every one of us in here today a winner today. So once again, thank you for coming. We have thank you to our senior leadership, Dr. Berger, Ms. Winston, Dr. Winston, Dr. Watson, we have Primrose. I did want to give a standing ovation celebration for 2 special ladies today. One, the lovely Miss Rolston, if you could stand up. And then also, we can stand up, everybody. Without Ms. Ralston and her support for nursing and Nurses Week, none of this would be possible. And for those who have worked at other organizations, you know that you don't always have a Ms. Ralston. So we are so thankful for you and your support this week, this month, and always, and we thank you, Ms. Ralston. And everybody besides Ms. Ralston can stay standing because Dr. Karen Brooms-James, our Director of ICL and Education, organized this event today. And she got all of this done in a few weeks, and we thank you so much. This was an amazing time. We appreciate you. Thank you to all of our leadership here today. Everyone can sit. Thank you all. Thank you to everybody that was nominated or won today, as well as our leadership supporting their staff. A few other special thanks. Miss Carol is not here today, but we have Reverend Walker. Thank you for being here. Miss Brenda Ellis, where are you? She also, in the back, Miss Ellis organized this whole event and this program, and we can't thank you enough. It was beautiful. We have Miss Monica Daffa. We have Holly Rossi. She did all the decorations and the drinks outside. So where's Miss Holly? Oh, okay, we'll say thanks to her. We have FMND, Jason and David, we thank you so much. We have Mr. Luke, we have Marcos from photography, and then we have our whole classroom services. So thank you so much to make this event happen today. I just wanted to end today by saying after today is over, after this week is over, and after this month is over, just remember every single day you make a difference. And this t-shirt and this week doesn't mean anything because we make a difference every day. Now it's in the songs in my head. We make a difference. And then just a reminder that, like I just said previously, but a smile, a kind word, a recognition, it goes a really long way. And we thank you for everything you do for your patients and for each other every day. And I hope everybody has a good rest of their evening. Thank you.
For all the people who were nominated, we have the certificates at the back.
Anybody who is nominated, you have your certificates in the back as well.
Thank you.